Heather Milan, and I'm going to be administering morphine PCA to my patient today. So I'm going to wash my hands, and the first thing I'm going to do is make sure that the physician's order and the MAR are exactly the same. So here I have the physician's order and the MAR. So this is for Marcy, Paris, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 55 years old, no allergies. So this is being prepared to given now. This is due now. This is the PCA order form, This is morphine, 1 milligram per milliliter, PCA dose of 1 milligram, lockout interval of 5 minutes, The physician has signed this, and the transcribing nurses have signed this, and this is to be given now. So these are all exactly the same. So I'm now going to take a look at my parenteral drug monograph. So this is for morphine. This is a high alert medication. It's an opioid analgesic. It can be given by a student nurse, and I've reviewed the WRHA policies surrounding giving this as a PCA. Make sure I don't miss anything. So this is compatible with D5W, normal saline, and various other things, but I'll be using normal saline. Some hazards are respiratory depression, shortness of breath, confusion, hypotension, nausea, vomiting. I will be letting my patient know about those before starting the infusion. I have monitored my patient's baseline pain, their pain relief, as well as their baseline respiratory and mental status and their baseline vitals, specifically their blood pressure. So I will be checking their vitals, respiratory and mental status very frequently while they are on the medication to keep an eye out for any of those hazards that I previously listed. So the recipe I'm looking for is for a concentration of 1 milligram per milliliter. So here I have the concentration of 1 milligram per milliliter, so I will be using this first recipe, and this is for PCA, and this is the recipe for PCA. So I will be drawing up 50 milligrams, which will be 10 milligram per milliliter, 1 milliliter ampules. I will then be diluting it with 45 milliliters of normal saline for a final volume of 50 milliliters and a final concentration of 1 milligram per milliliter. So now what I'm going to do is I'm going to find my medication. So I have 5 ampules here, and for demo purpose, I'm just going to be doing my checks with one, but first I'm going to verify that all of these are exactly the same. So I have morphine. This is 10 milligrams per milliliter, 10 milligrams per milliliter, 10 milligrams per milliliter, 10 milligrams per milliliter, and these are all 1 milliliter ampules. 1 milliliter, 1 milliliter, 1 milliliter, 1 milliliter, and 1 milliliter. These can all be given IV, and these are not expired. So in clinical practice, I will be doing every check with every ampule, but for demo purposes, I'm going to be doing the check with one, just to save some time. So I'm going to begin my first medication check with the MAR, PDM, and the medication ampule. So this is from Marcy, Paris. This is PCA, so this is the recipe for PCA. This is morphine. 1 milligram per milliliter. So here I have the recipe for 1 milligram per milliliter. I will be drawing up 50 milligrams, so 10 milligram per milliliter, 1 milliliter ampules. So this is 1, 2, 3, 4, 5, 10 milligram per milliliter. This is 10 milligram per milliliter. This is a 1 milliliter ampule, 1 milliliter ampule. I will then be diluting with 45 milliliters of normal saline for a final volume of 50 milliliters and a final concentration of 1 milligram per milliliter. So this is going to be given IV, this is to be given IV, and these can be given IV. This is due now, so I'll be preparing and giving it now with a PCA dose of 1 milligram and a lockout interval of 5 minutes. So those are all good to go. So now I'm going to make some medication labels for myself. So I know here I have a 50 milliliter bag of normal saline, not expired, never been opened, but I only want 45 milliliters of normal saline. So I will be pulling up and discarding of 5 milliliters. So I'm going to make a medication label for the syringe that is going to hold that normal saline. So this is for Mandy Paris. This is just normal saline with a volume of 5 milliliters because 50 minus 45 is 5. There's no diluent in the syringe and the concentration is not applicable. So this is for November 20th, that's a 2, at 13:30, and I am Heather Milan, University of Manitoba student nurse 3. So this is going to be with the syringe to pull up the normal saline. Next, I'm going to create a medication label for the syringe that is going to pull up the medication. So this is for Marcy, Paris. The drug name is morphine. The dose in the syringe is going to be 50 milligrams. The volume, because I'm pulling up 5 1 milliliter ampules, should be 5 milliliters. There's no diluent in the syringe, and the concentration is 10 milligrams per milliliter. It is November 20th at 13:30, and I'm Heather Milan, University of Manitoba student nurse 3. So that is going to be the syringe for that. And lastly, I'm going to create a medication label for the mini bag for after I inject the medication. So this is for Marcy, Paris. This is morphine. The dose in the bag is going to be 50 milligrams. And the volume of the medication is 5 milliliters. The diluent is 45 milliliters of normal saline for a concentration of 1 milligram per milliliter. It is November 20th at 13:30, and I'm Heather Milan, University of Manitoba student nurse 3. This is to be given PCA with a dose of 1 milligram and a lockout of 5 minutes and a final bag volume of 50 milliliters. So here I have 50 milliliters, so that's good to go. So now I'm going to be pulling up the normal saline that I'm discarding. So again, I want 5 milliliters because this is a 50 milliliter bag, and I only want 45. This blunt fill doesn't actually have blunt fill, so I'll be using this one. So I will be cleaning the mini bag for 30 seconds and drying for 15. And I'm pulling out 5 milliliters. And I'm going to make sure that I do have 5 milliliters. And that is 5 milliliters. So I'm going to label this and put it off to the side. So in clinical practice, I would be using a blunt fill filter to pull up from an ampule, but they are very difficult to use in the demo setting when they are reused. So I will just be using a normal blunt fill, and I would also be taking the blunt fill filter and switching it out with a regular one before injecting into the mini bag, but for demo practice, I will just be using the one blunt fill. So in clinical practice, I would have broken and cleaned these all appropriately. So I'm drawing up 1 milliliter from each of these ampules. I'm just going to get a little bit of air out of here. And again, I'll just get a little bit of air. Great, so I'm going to make sure that I do in fact have 5 milliliters here. And I see I've pulled up a little bit extra, so over the sink I'm going to be med wasting what I'm not using. And here I have 5 milliliters, 5 milliliters. So I'm going to be labeling this. And I'm going to begin my first medication check. So the check is going to be with the MAR PDM medication ampules, the syringe holding the medication, the mini bag, the final bag label, and the syringe with the normal saline that I'm discarding. So this is for Marcy Paris, Marcy Paris, Marcy Paris, Marcy Paris. This is morphine, 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 and this is going to contain morphine. This is 1 milligram per milliliter, so I've used the recipe for 1 milligram per milliliter, which means drawing up 50 milligrams, which is 5, 10 milligram per milliliter, 1 milliliter ampules for a volume of 5 milliliters. And so that says this is a final medication volume of 5 milliliters. And these are 1 milliliter ampules. I will then be diluting that with 45 milliliters of normal saline. So here I have 50 milliliters of normal saline, and I took out 5 milliliters to discard to give the bag volume 45 milliliters. So that will give me a final volume of 50 milliliters once I add the medication. And a final concentration of 1 milligram per milliliter, 1 milligram per milliliter. These can be given IV, and this is going to be given IV and IV. The PCA dose is 1 milligram, PCA dose of 1 milligram, lockout interval of 5 minutes, lockout interval of 5 minutes, final bag volume of 50 milliliters. And this is due now, so I'll be preparing to give it now, and this is the recipe for PCA and PCA. So that is all exactly how I want it, so I'm going to get a second nurse to come and verify that everything is correct. The nurse says it's good, so I'm going to put these in the medication waste. I'm going to discard of the normal saline. This is going to go into the sharps, and this is going to go into the garbage. And I'm going to add the medication into the mini bag. So I'm going to clean for 30 seconds and dry for 15. That is dry, so I'm going to insert the medication. This is going to go into the sharps, this is going to go into the garbage, and I'm going to gently roll the medication to make sure it's all evenly distributed. And now I'm going to label it. So now that that is good to go, I'm going to take my MAR, second nurse, and my medication, and I'm going to head to the patient's bedside. Alright, I can also wash my hands. Knock on door. Hello, my name is Heather Milan, and I'm a student nurse that's here to administer a medication for you today. So I'm doing an entrance safety check. The patient is not in distress, the call bell's in reach, and there are no hazards within the room. So I'm going to go verify I have the correct patient. So looking at the wristband to my MAR, I'm seeing Marcy, Paris, Finn, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 55 years old with no allergy bracelet. I will now be asking my patient verbally to tell me their first name, last name, birth date, and allergies. That all checks out, so I'll tell my patient what I'm here to do today. So I'm here to change the bag for your PCA morphine. Morphine is a medication to help with your pain relief. I have checked your baseline vitals, respiratory, and mental status because some of the hazards of the medication is that it may slow down your breathing, make you nauseous or confused, so you can keep an eye out for those symptoms. PCA works where you can press the button every 5 minutes to receive a dose. If you don't press the button, you won't receive a dose, but if you press it before, you won't receive a dose because we don't want you to get too much medication. So 5 minutes is your interval here. So yeah, I've assessed your baseline vitals, respiratory, and mental status, and I will be assessing that very frequently after I start the infusion. Do you have any questions before I begin? And do you consent? Great, so I'm going to take a look at what's currently infusing. So I'm seeing that normal saline is here, which is compatible with my medication, and it is in the clamp running at a TKVO rate, or in the pump I mean. So I'm going to follow the tubing all the way to my patient to make sure all the clamps are open. And they are, which means that it's infusing, and I'm not noting any swelling, redness, or irritation at the IV insertion site, so I know that that is a patent IV. So now I'm going to go ahead and do my third medication check. So this is Marcy Paris. This is for Marcy Paris. This is Morphine. 50 milliliters is the... Actually, I made a mistake on my med label here, so I'm just going to correct this. I got a pen, I didn't leave the room. The dose is not 50 milliliters, it's 50 milligrams. So that is my correction there. Yes, sorry about that, but I didn't leave the patient's room. So the dose is 50 milligrams, which when diluted with 45 milliliters of normal saline will give me a final concentration of 1 milligram per milliliter, and here I want 1 milligram per milliliter. The PCA dose is 1 milligram. Lockout interval is 5 minutes. Final bag volume of 50 milliliters. And this is due now, so I'm preparing to give it now. And this is the PCA form, so I'll be using the PCA machine. And this can be given IV, so that is all good. So I have a second nurse here who is going to watch me as I insert all the information into the PCA machine to make sure it is all correct. So I'm going to go on. I can actually open this up, just get it out of the way.
Sorry, this is like a lab use.
Alright, so I am going to program. I'm going to find the code on the back, which is 94629. 94629. Alright, so I am in fact using units as milligrams because the concentration is 1 milligram and the dose is 1 milligram. So milligrams is correct. The concentration in milligrams per milliliter is 1 milligram per milliliter, 1 milligram per milliliter. Yes, this is to be given IV. It says here IV, and I'll be giving this IV, so that is correct. Loading dose, there is no loading dose, so 0 is correct. Med limits off is correct. And next, yes. Bag volume is 50 milliliters because I added 5 milliliters of medication to 45 milliliters of normal saline. So the volume is 50. Yes. Basal rate, there's no basal rate, so 0 is correct. Patient bolus is 1 milligram. Yes. And the bolus interval is 5 minutes. So that is correct. And boluses per hour, 60 divided by 5 is 12. So that is the amount of boluses the patient can receive in an hour. So that is yes. Done. Yes, I've had the second nurse verify that everything I put into the pump was correct, as well as referencing my MAR and my mini bag. So that is yes. So now I'm going to be switching out this bag for the one that's currently in here. So I'm going to maintain sterility of the spike here. And I spilled a little bit of the old bag on the floor, so I'll be cleaning that up before I leave. That is spiked, so I'll hang this here. And I'll be med wasting of this with the second nurse after I leave the room. So this is hanging. So I will close it and lock it. And I'm now going to press run because the second nurse has verified that everything is correct. So I'm going to press run. And I'm looking for a green flashing light with which I am seeing, so I know that this is ready to go. I'm going to follow the tubing all the way down to the patient to make sure that all of the clamps are open. And they are, so again, I can follow the TKVO infusion tubing all the way to the patient to make sure those clamps are open.
5 minutes.
And they are, so I'm going to make sure that the PCA button is within reach of the patient so they can access it when they need it.
The line.
This is locked, so I'm going to begin my exit safety check. So the TKVO, all of the clamps are open, and that is infusing appropriately. The PCA, all of the clamps are open, and that is infusing appropriately. I know because of the green flashing light, it is locked, and the button is within reach of the patient here. The call bell is within reach of the patient. The patient knows that I'll be back very frequently to assess their vitals, mental, and respiratory status, and they know which symptoms to look out for in the case of a reaction to the medication. So I'll be removing the medication to waste. And the button's in reach, the pump is locked, all of the clamps are open, and the green light is flashing, call bell's in reach. There's no hazards in the room, so I'm leaving to document. So what I'm documenting is the time I changed the bag, the second nurse signature, what the bolus, or what the PCA dose was, what the lockout interval was, that's infusing into the peripheral IV, that there's a TKVO infusion running as well, that there's no redness, irritation, or swelling at the insertion site, the second nurse signature, and that my plan is to come back to frequently assess their vital signs, respiratory, and mental status while they are on the infusion to make sure they don't have any negative reactions to the medication. So I'll be documenting all of that now as I leave the room.